I just want to say thank you to all for being here. My name is Claudia Tenney. I represent the New York's 22nd Congressional District, and I know many of you, and we are so grateful to all of you for traveling here from all over the world, basically. Your commitment, your passion, your tenacity are an inspiration to all of us as we are so excited about presenting the Essential Caregivers Act. A recent study, and I want to make sure we know this information is out there, found that individuals who are lonely are at a 59% greater risk of physical or mental decline and 45% risk of death. This group standing with me today knows this all too well after the last 15 months of lockdowns we've been through the pandemic. We're here today because over the course of the past year, seniors, those with intellectual disabilities and others in long-term care facilities suffered alone in isolation. The caregivers here today from every corner of our nation were cut off from their loved ones, forced to communicate over FaceTime or through a window for months on end. The separation caused already vulnerable populations to suffer even more. When my own parents were both older and sick, I was their primary caregiver. I saw them every day as they lived across the street. I cannot imagine living through what these individuals have suffered through today. That's why I've introduced HR3733, the Essential Caregivers Act. This bill amends the Social Security Act to create an essential caregiver program for any future public health emergency. Under this program, residents in long-term care facilities will have the right to designate up to 2 essential caregivers who would be permitted access to residents. This means that family members and loved ones would be allowed to enter facilities in the future to provide care and support the residents who they have come to rely upon. This bill upholds strict safety and health standards to protect residents, staff, and the caregivers. Any essential caregiver must comply with whatever health standards are put in place by a facility. This includes testing, PPE, and social distancing. The individuals here with me today will tell you why this bill is so important to them. Essential caregivers are not just visitors. They are, as the name implies, caregivers. They help with activities of daily living and provide emotional support and companionship. This care enriches the lives of residents, enhances their well-being, and helps them thrive physically, emotionally, and socially. Without it, residents ultimately suffer, and this is exactly what we saw during the 15-month lockdown. During lockdowns, many residents declined dramatically, and some even lost the will to live. The importance of essential caregivers in no way diminishes the critical role that facility staff play in resident lives, which during this pandemic was nothing short of heroic. Essential caregivers simply supplement the high-quality care provided by facility staff. They are a force multiplier that enhances the ability of residents to thrive and live their lives fully. Last night, I shared testimonies on the House floor that were submitted by caregivers from around the country. My office received over 100 stories from New York, Connecticut, Florida, Tennessee, Vermont, Kentucky, Kansas, California, Wisconsin, North Carolina, Illinois, Pennsylvania, New Jersey, Oklahoma, Maryland, Georgia, Arizona, Indiana, and many, many more. And we continue to hear from people who support the Essential Caregivers Act. These stories were deeply personal, heartfelt, and absolutely harrowing. While time did not allow me to read every personal account on the floor, I will be posting them on my website for all to see, and you will hear some of the stories today. Take Carla Abraham Conley's story, for example. Carla's from my district, New York's 22nd District. She lost her mother, Rosemary, during the lockdown. She died from isolation and the failure to thrive. If Carla had been allowed into the facility, Rosemary would likely be with us here today. Carla, I want you to know that your mother is looking down on you now. Where's Carla?
Right here.
She is. So very proud of everything you've done for her and of everything you're doing now for this positive change. And let me tell you something, Carla is relentless. She's got an amazing Facebook page, and she's a consistent and constant, tenacious advocate. There's also the story of Vivian Zayas and Alex Rivera, founders of Voices for Senior in New York. Vivian and Alexa lost their mother, Anna, because of Cuomo's negligent policies and malpractice. They never had a chance to say goodbye. They've now made it their life's missions to bring accountability to Albany and get the Essential Caregiver Act passed now. I stand with Carla, Vivian, and Alexa, and all those with me today and around the country who could not be here, to call on Congress to pass the Bipartisan Essential Caregivers Act. Residents' rights and that protects resident rights and recognizes that isolation does kill. Thank you so much. And with that, I'd like to turn this over to my co-sponsor, Congressman John Larson. I really am grateful for him to co-lead this effort. Congressman Larson, you're up next.
Thank you, Claudia, and thank everybody for gathering here this morning. I don't think there's anybody here or throughout the country who doesn't understand how COVID has turned our lives upside down. And in the process of that, we saw the heartache. We saw what happened when people were isolated with their loved ones oftentimes looking through a window or unable to reach out and help in a manner that's both compassionate, caring, and committed to doing the right thing on behalf of the people that we love. I want to commend Claudia for her effort. This bill will travel through the Ways and Means Committee and the Social Security Subcommittee, of which I chair. And we're very pleased to see the kind of turnout and support both from my home state, and you'll be hearing from Marie Painter later. But I want to also acknowledge people like my niece, Catherine Downs, who's here and traveling from Connecticut, as well as many individuals who, if you're going to make a change in life, whether it's in government or whether it's in community involvement, it requires commitment and action. You being here today, the leadership of Claudia and other members of Congress who will join us is essential and important, but nothing's more essential for caregivers than to have the people who they trust and love be able to be there for them.
Thank you, sir.
So thank you so much, and I believe, Claudia, I turn it back to you.
Thank you.
And,
Here, we can leave that there.
oh yeah, that's yours. You don't want to take your cheat sheet with you?
I just need the run a show here. Thank you so much, Congressman Larson. It's a pleasure to work with you. I hope you can get Richie Neal and everybody on the Ways and Means Committee to get this through. And we're working hard on getting a Senate sponsor to make sure we make this a reality for the people standing here behind us. Next, I'd like to introduce my colleague, John Rutherford from Florida. Congressman.
Thank you, Claudia, and thank all of you for being here today as we show our support for this Essential Caregiver Act, HR 3733. You know, as John was talking about the images that we all saw of people with their hands pressed against the glass, trying to have that human contact. We're here today because these folks know that we can never let what happened happen again. We cannot allow what happened during this pandemic to ever happen again. In our efforts to stop the spread of COVID-19, many experience the negative effects of isolation and loneliness. This is especially true for those who are residing in these long-term care facilities, who were prohibited from seeing and touching their family members. The Essential Caregivers Act gives these folks behind me a lifeline, allowing their loved ones to visit even during a public health emergency. Now, they will still need to pass through proper health and safety protocols, but we will no longer allow individuals to suffer in isolation. I also want to thank Governor Ron DeSantis, and I want to thank Mary Daniels, who you'll hear from shortly. Mary is the one that brought this issue to me in my home state of Florida. Governor DeSantis stepped up for the state of Florida, put together a task force, and addressed this issue way back in September. And so we thank him for that, and I thank Mary and all of these advocates behind us who made that happen in their individual states as well. But I particularly want to thank Claudia Tenney, my good friend from New York, for making this happen at the national level, because this is what we need, Claudia. We need a national fix, because all of these folks across this country have been negatively impacted by this protocol. So thank you, and let's get this done.
Thank you. Grateful for your support. Now I'd like to introduce our relentless advocate behind me, Carla Abraham Conley.
Thank you, Claudia. Thank you to everybody that stands beside me, behind me, out there in the web world. So I was a huge advocate, but first and foremost, I was an essential caregiver. My mother was 78 years old, put into a nursing home where she actually walked herself into, took her out took her out as much as I could, but every 2 weeks, I did take her to get her nails and her toes done, because that was my mom. That was Rosie. Come December, a neglect on the nursing home, she fell, unable to walk any longer. March came and the lockdown came. I was there every day, every single day. My father was there every single day. I saw the changes. I felt I was one of the lucky ones that I got to FaceTime with my mother every day, because window visits, I couldn't do it. I tried. She didn't understand why we couldn't come in. Couldn't get it. So FaceTime it was. I watched my mother's decline daily. I made calls for compassionate care visits. I was denied because my mother wasn't dying. There's a distinct difference between compassionate care and end of life. Our nursing homes, our long-term care facilities are refusing to acknowledge that. I was at my wit's end. I met up with Claudia in September of 2020. We did everything we could. It kind of came to a standstill for a while. January came, we went hard at work. I have a team of advocates behind me from across the country that we worked diligently to get this bill where it needed to be. I'm proud of what we did. I'm proud of the work. And I'm proud that my congresswoman from my little town of Utica stood up and said, let's do this. Thank you.
Appreciate it. Good job. Thank you. Thank you so much, Carla. And I just have to say that the nursing home where Carla's mother was, one of my friends actually is in the neighborhood and alerted to me to this policy of Governor Cuomo that she said, Claudia, you've got to check this out. There are literally ambulances coming in and hearses pulling out. And something like almost 50 people died from being exposed to COVID in that particular nursing home in our region. And so I'm grateful to Carla also for making this, just being on top of this. And there was a little pause, Carla, because I wasn't elected yet. And
Yep.
it took 100 days to count the votes in my race to finally get me sworn in by February 11th. But we're grateful for your patience. And also there are a lot of people, and I know there's so many people. I'd love to have you all speak, but I think we'll all melt by the time we get to the end. But I wanted to give Vivian Zayas, a chance to speak from Long Island. Vivian and Voices for Seniors, they're her sisters, they reached out to me and did a Zoom call, and I was brought to tears by the Zoom call. I mean, they were just so amazing. And all of these people have suffered tragedies, and their willingness to be so persistent, to be positive and tenacious in the face of this tragedy was what was so inspiring to me. And I just want to have Vivian come up and speak about her situation. Thank you.
Hi, good morning. Well, on behalf of the members of Voices for Seniors, we want to express our gratitude to Congresswoman Claudia Tenney, not only for meeting with us, but for listening to us, for incorporating our suggestions and allowing us to participate in this process. On behalf of the grieving and distressed families of rehab and nursing home residents, my sister Alexa, who is recuperating from surgery, would have wanted to thank you herself. Prior to the pandemic, my sister and I were my mom's fiercest advocates and caregivers. When doctors recommended knee surgery, we searched for the best doctors, planned her recovery and aided in her recuperation. We spared no sacrifice to care for her. When the hospital suggested she would benefit from additional rehab at the nearby nursing home rehab facility, we reluctantly agreed. 3 weeks later, 3 weeks turned into 3 months, and yet we were by her side, as was our norm. When the order came to shut the facilities, we could have never imagined that my mother would be dead 3 weeks later. Our mother and countless full-time and rehab residents met their fate alone. Countless stories of neglect and insufficient staffing precipitated the death of so many. They were inside, afraid and defenseless, and we were outside, bewildered and powerless. It is our hope that the Essential Caregiver Act will put safeguards so that no one will suffer what we have all suffered. We sadly can't change what happened, but we can definitely change the future. We want to express our appreciation for the bipartisan support given to the Essential Care Act, and the hope that it instills in us much comfort and hope. Thank you.
Thank you. Thank you so much. We really appreciate it. I just want to make a mention also, there is a guy named Michael Carey whose son Jonathan died due to negligence, gross negligence, in a adult care facility in New York. And I just want to thank him for his relentless advocacy on this. He wasn't able to be with us here today, but Michael has been a huge advocate since he lost his dear son, Jonathan. And just want to make sure I say thank you to Michael Carey, who is, when I was served in the State Assembly, he was literally in session every single day watching the proceedings and begging people to help. And he finally did get a provision passed in honor and memory of his son, Jonathan. Next, Representative Larson, you have an introduction.
Well, thank you, Claudia. And Carla and Vivian, thank you for your remarks. And I'm indeed honored to be able to introduce Mairead Painter. And Mairead is the Connecticut State Long-Term Care Ombudsman and actually Vice President of the National Association of States Ombudsman's programs throughout the country. Does an outstanding job from my home state of Connecticut. Mairead, the podium is yours.
Thank you. Good morning. Thank you, Congressman Tenney. Thank you, Congressman Larson. And thank you to all of the family members and residents that are here today. My name is Mairead Painter. As Congressman Larson said, I'm the State Long-Term Care Ombudsman in Connecticut. Most people don't know what an ombudsman is until they need one. So the ombudsman, everybody here hopefully knows, the ombudsman represents the rights and the overall well-being of residents in long-term care communities. So that's nursing homes, in some states it's residential care homes, assisted living communities. I'm here today because in Connecticut we saw what happened when we didn't have a plan. We didn't have a mechanism in place in order to respond to both the medical needs and the overall social and emotional well-being for the individuals that choose to make long-term care communities their homes. They choose this in order to receive their long-term services and supports, but that doesn't mean that they give up any of their constitutional rights and freedoms. That's what we saw happen during the pandemic. Learning from that experience and taking this opportunity to put something in place now so that people never have to experience that again is very forward-thinking, and I am so appreciative that we're doing that. We know that today there are still residents that do not have unimpeded access to the individuals who matter the most to them in their lives. I'm often asked about staff and how come you need essential caregivers if you have staff. Well, the staff are wonderful, but we were receiving desperate phone calls from staff because I don't think the general public really understand how much care and support family and friends give in long-term care communities. They're not saying that the staff aren't doing a wonderful job. They're saying that they are unpaid support that has always been there, and when, like a vacuum, that was sucked out, the staff were left desperate trying to decide who got what care and what was essential. For some of the most critical residents, that meant that they went without needs that should have been met on a daily basis. Residents spent almost a year isolated in their room. I know for me and my kids, we spent till like June locked in our houses, and that got to be a lot. I can't imagine being in my room alone, not being able to connect with family and friends. With everything that was happening in our world, all they had was the connection to the television. I think buildings tried really hard through virtual visits, phone calls and window visits, but that doesn't change the need for that human contact, that basic human right to be connected with loved ones. So I'm very thankful. I think we can all learn from this, and we need to make sure that our states across the country have mechanisms in place. Connecticut did a great job, and we did pass an essential caregivers bill this session. However, we know that that can be waived at a federal level, and that's why this is so important, and it's important that every state reach out and educate individuals who make these decisions. So thank you very much.
Thank you. Now, Congressman Rutherford has an introduction.
Thank you. I'm very proud to present this afternoon Mary Daniel. Come up here, Mary. Mary Daniel's from Florida, and the first meeting that Mary and I had in my office, I have to tell you, I realized right away, now she may not look like it, but she's a fighter. And she went to work for this cause, and you always need someone that will pick up that torch and carry it, and Mary did, and I thank you for that. And tell your story, Mary.
Thank you. Hi, I am Mary Daniel, the wife of Steve. My husband is 67 years old. He was diagnosed 8 years ago with Alzheimer's, and he's been a resident of a memory care center in Jacksonville for the last 2 years. When the lockdown happened, I was a daily visitor, and when the days turned into weeks and the weeks turned into months, I knew I had to do something. So I asked the facility for a job. And 1 year ago this Saturday, on July the 3rd, I did my first shift as a dishwasher, and after 114 days, I was able to hug my husband again. The good news is he remembered me. That was my fear. My fear was that I was going to miss the window of opportunity of when he knew me, and I knew I had to fight back. And when that story went viral, I also knew there were so many other people out there just like me, and Caregivers for Compromise was founded, and groups in every state that are so widely represented with the people behind me have grown and really made a difference across the United States. We know why the lockdown happened. We know that COVID kills, but we also know that isolation kills too. And we're here to be sure that this never, ever happens again. We are the United States of America. When we know better, we need to do better. So it's time for us to get to work. Thank you.
Thank you so much, Mary. It's now my pleasure to introduce Sam Kukic.
Good morning. I'm here today in support of HR3733 for a variety of reasons, but most importantly, an incident that happened less than a week ago. A 68-year-old grandmother was arrested at a nursing home for escorting a grieving daughter to visit her dying mother. It's true. The daughter was overwhelmed with anxiety and with the thought of her mother dying alone in a nursing home. So she called upon the older woman for support and comfort. Upon entering the nursing home, they were told they had to exit the building and call the director of nursing to make an appointment. Neither the daughter nor the old woman caused any disturbance. However, the nursing home did not like the old woman because she reported abuse and lacked the care at the facility when her mother-in-law was in that same facility 3 years ago. This facility charged her with trespassing to prevent her from visiting any residents even before COVID. The daughter was able to enter the facility 45 minutes later with a hospital staff member for the allotted 1-hour visit. The old woman was ordered to leave, however, she requested to stay outside and wait to ensure the daughter was okay after her visit. This was unacceptable to the facility, so she was arrested. The police handcuffed the old lady's hands behind her back, took away her purse and belongings, and placed her in the back seat of a patrol car. They drove her to the city jail where she was frisked, had a mugshot taken, fingerprinted, and made to feel like a common criminal. That bill will prevent that from ever happening again. Many family members are watching their loved ones deteriorate rapidly due to isolation and inadequate care. The problem is they can't get into the facilities. I know because I am that old lady that was arrested. My name is Sam Kukic, and I'm the Director of Dignity for the Aged, and we have over 1,000 members throughout the United States, Europe, Africa, New Zealand, and Australia. The problem of residents being abused, neglected, and dying is huge. especially when one CNA is responsible for 20, 30, or more residents. It's my hope that another bill will be passed also to establish ratios of 6-to-1 to provide the care they deserve.
Yes.
Instead of spending millions of taxpayer money for 18 years of studies, in the state of Virginia anyway. I'm here to say that I totally support HR3733, which would permit essential caregivers access during any public health emergency under the Medicare and Medicaid programs. Our elderly do not have the privileges that the inmates have in the jail, like the one I was in last week. These are nursing homes, not jails. I went to jail for every single person in a nursing home who needs a voice, and today we are their voice. And I support this bill. Thank you.
You sure don't look like one. Thank you so much for that. That was amazing to hear that. Now our next speaker is going to be Catherine Carlton, who is a nurse practitioner.
Thank you. Good morning, everyone. Thank you for inviting me to speak today. My name is Catherine Carlton, and I'm a nurse practitioner from northern New Jersey and personally witnessed the devastation that COVID brought to our long-term care facilities these past 17 months. In March of 2020, northern New Jersey was hit hard, with many cases and lives lost in our nursing homes. I personally lost 5 patients within an 8-hour span. At that time, we had inadequate supplies of PPE and limited testing. Our hospitals were overburdened, with multiple ICUs being built to handle demand, and in March 2020, nursing home visitations were shut down. Over the next few months, supply chains improved, testing was standardized, and PPE made available. The medical community made great advancements with treatment protocols and vaccine development. Restrictions in our communities started to ease. However, visitation still was not allowed in nursing homes. As a result, FACE, an advocacy group in New Jersey, was formed in July. Our email campaigns to the Department of Health assisted with the passing of an executive order for essential caregiver visits in August. When essential caregiver visits were permitted in my facilities, I witnessed residents being taken off of antipsychotic medications, stabilization of weight loss, and an improvement with depression. One daughter thanked me for our group's hard work. Kathy, my father grabbed my head so hard and hugged me. He wouldn't let go. His health had deteriorated, and sadly he passed 2 days later, but his daughter was so grateful that she could care for him. Sadly, visitation was not implemented consistently among the nursing homes, and a majority of families were denied visits. Practitioners dealt with the sequelae of isolation as residents were suffering from weight loss, depression, and an acceleration in cognitive decline due to lockdown. Families were tormented. Orders were written for antidepressants, antipsychotics, appetite stimulants, and psychotherapy. FaceTime visits were arranged, and residents were wheeled to windows for family visits. Many of our elderly have hearing and visual deficits, and those with moderate to advanced dementia truly suffered. These panacea were the equivalent of putting Band-Aids on gaping wounds. As a practitioner, I have never witnessed such prolonged and piercing cruelty that our residents and family have had to, and in some cases, continue to endure. Every day I experienced heartache. I held hands of residents who were actively passing while family members peered in from an outside window. It was heart-wrenching. I felt like we were all prisoners. Isolation has taken its toll. In essence, it became the new pandemic. I am here as a nurse practitioner to advocate for nursing home residents and families. The Essential Caregiver Act, HR3733, asks for 2 essential caregivers to be allowed visitation up to 12 hours daily and an unlimited visitation for end of life. Facilities must be provided with a bill that is clear and straightforward so that visitation can be implemented universally and consistently. Visitation is a human right for both patients and their loved ones. I am respectfully asking for the House to pass this bipartisan bill. Thank you for your strong consideration.
Thank you. That was fantastic, Catherine. Thank you so much. Next, I want to introduce Marla Carter from the Kentucky Caregivers for Compromise.
Hi, good morning. Proverbs 31:8 says, "Speak up for those who cannot speak for themselves, for the rights of all who are destitute." Throughout the pandemic, I prayed almost daily for opportunities to speak out for those who can't speak for themselves, and God has delivered. Look where I am. Wow. I'm here today to be a voice for the 27,000 nursing home residents in Kentucky. While other states were busy passing essential caregiver bills, I was bothering my state legislators. I was contacting them, sending them drafts of bills from other states, asking them to please protect residents of long-term care, to keep them connected to their loved ones and give them access to the caregivers who are their lifeline. And yet, Kentucky did not enact essential caregiver legislation. This is why we need a federal bill. Long-term care residents in states without essential caregiver bills need to have their voices heard and their rights protected. In a matter of months, my own mother-in-law has stopped walking, lost nearly all her muscle mass, and is no longer able to carry on a conversation. On the paperwork we received from the last hospital visit to the ER that she had, it lists failure to thrive as one of the primary concerns. If you follow the issues surrounding long-term care in this country, you probably already know that our system is broken and it doesn't have any easy solutions. So family members and loved ones often fill in the gaps in that broken system. They are the ones making sure that residents eat, get a shower, get the proper medical treatments and medicine. It's family members and loved ones who are the first ones to notice when something is wrong with a resident, and they won't stop fighting until the problem gets solved. Without that person to fight for them and to be their voice, they can suffer additional harm that could be avoided, and they lose the person who keeps them connected to themselves, to their stories, and to their worth. To my dear nursing home friends in Kentucky, we see you, we hear you, we are your voice today. Thank you.
Thank you. Thank you, Marla. Thank you, great job. Let's get everyone from Kentucky on this bill. I want to thank you, and also want to introduce Charlie Galligan from Rhode Island.
Hi, good morning, everybody, and thanks for being here. I'll confess off the top, I'm not quite as civilized as the speakers before me, but I'll do my best to fake it for a few minutes. As evidence, my scribble notes are on an Amtrak cocktail napkin I wrote down on the way down yesterday. I want to open just by saying, on behalf of all of us and all the long-term care residents and families across the country, a real sincere, heartfelt thank you to all the staff, the CNAs, nurses, and support staff who worked through this horrible pandemic. We are eternally grateful, and we want you to know that. I will say that we were hoping from some of the brass in the nursing home industry, the administrators and CEOs, we were hoping to see just a fraction of the dedication and compassion shown by their wonderful staffs through this pandemic, and not all of them, but for many of them, sadly, that was woefully lacking. I'm here inspired by my parents, Audrey, my mom. She's a feisty Bronx broad. My dad, Jack, he grew up just down the road here, actually. And they live up in Rhode Island. My mother's in a nursing home just around the corner from our house. I live with my wife, Carrie, and my father, Jack. He has Alzheimer's, and we house him at home. Before the pandemic, my father was with my brain-injured mom every day. My wife and I were there every night. And when we got kicked out, like everybody else, we didn't know, nobody knew what the heck was going on. It made perfect sense. But the months went on, and then the residents got vaccinated, we got vaccinated, and I could clearly see that there was no urgency whatsoever on the part of the nursing home industry as a whole, there are exceptions, to get families back in to help supplement the care that these CNAs and nurses so desperately needed. I can tell you my day job, I work as a criminal private investigator, which brings me to the prisons a lot, and having great familiarity with visitation at the prisons during the pandemic, I can tell you regrettably that there was more humanity and privacy offered at some prison visits than some of what we saw at the nursing homes. And my mother and everybody's mom, dad, they don't deserve, many of them died, as you know, and they didn't deserve to go out in the last months of their lives in solitary confinement for crimes that they never committed. So, and here now we are pushing July of 2021, and I'm still getting stories every single day about hassles families are going through. My friend told me the other day, outside in a courtyard, everybody vaccinated, have to wear the mask, and after 45 minutes they got the boot. And they said, what's the story? We're outside, we got masks, we've been vaccinated, this guy hasn't had a visitor in 15 months. Good to hear, beat it. It's outrageous, it's just outrageous. And why? What's the motive, the ulterior motive? Again, from some in the nursing home industry. I'm sorry, it's not still about COVID prevention on June 30th of 2021. There's an ulterior motive. They don't want families, many of them don't want families back in there. They don't want you to see what's going on in there. It's easier for them to operate their business, please, would you? It's easier for them to operate their business without pesky sons and daughters like us, viewing the care. That's just not an ethical reason to let these old men and women die in horrible isolation. Also, we're concerned that the industry, having gotten away with this for 15 months, pushing 16 months now, what's to prevent them from parlaying this into kicking us out for 3 or 4 months every winter when somebody gets the norovirus or the flu? What's to say they can't do that? We need this HR 3733 to keep the industry in check. You know, I love the phrase, we protected them to death. I'm a plagiarist, so it didn't come from me, but it's been bounced around, and it's so true. I love that phrase, that we protected them to death. I love the phrase, but I hate the intent. And I can tell you it's accurate, it's not exaggerated. Many of these ladies and men, we did protect them to death. And one that I did come up with is, I feel, to all the reps, thank you so much to all of you, really. We really appreciate it. We need some more support. I'm talking about my rep, David Cicilline from Rhode Island. I'd love to meet with you, and Richard Neal, Chair of the House and Ways. Love to meet with you and discuss this bill. And to anybody that's still on the fence about this bill, I can say, just talk to these families. You all know somebody with a loved one in a nursing home. Go have a coffee or a beer with them. Hear their story. There's no way you can hear this story and not be with us and not support this bill. And to anybody who still is, if you're complacent on this bill, if you're complacent on this issue, you'll be complicit in the miserable, horrible, lonely, confused, isolated deaths that these people continue at the end of their lives. Please support HR 3733, and thanks everybody for listening.
Thank you. Well, that was fantastic. What a great way to end, because if you have a representative in that any of the people here, we are Congressman Rutherford, Congressman Larson, and the other sponsors, we will be actively looking for supporters, and we would also love to continue reading your stories in live session on the House floor so that people understand this. And we know that it's compelling for them to hear your stories. Just kind of be persistent like you have been. And I just want to say thank you to everyone for being here. I know it's very hot. I just have one more item to say. I have a very dear friend who I want to say happy birthday to today. Her name is Mary Malinowski. She is 108 years old today. She's in a nursing home in Rome, and unfortunately I can't be there with her today. Last year we did a drive-through birthday wave to her. I was on my motorcycle along with another bunch of people. And but Mary is also struggling with isolation and feeling lonely, and no one can visit her. Now, can you imagine she's survived this pandemic? She's 108 today. And so thank you for all being so resilient, sitting here in the swampy heat that we have in Washington, D.C. But this is important, it's essential, and we are so excited and proud of all of you. Let's keep fighting all the way to making sure this bill becomes a law. Thanks so much to everyone here, especially Congressman Larson and Congressman Rutherford and all the sponsors. Let's get as many people on board as we can. Thanks so much for everyone.